This podcast is for informational purposes only and should not be considered medical or health advice. This podcast is not intended to replace professional medical advice, nor have the statements been evaluated by the US FDA or similar international bodies. We are not responsible for any losses, damages, or liabilities that may arise from the use of information shared during this podcast. The views expressed in this podcast may not be those of the host. Greetings, health and human enthusiasts, and welcome to the Regaining Health and Humanity podcast. I'm your trusted guide, Dr. Scott Johnson, and I'm both humbled and thrilled that you've chosen to join me on this fearless pursuit of knowledge and inspiration. My mission is to elevate your well-being naturally, arming you with evidence-based insights, revolutionary breakthroughs, and impactful health tactics. But that's not all. Together, we'll dive deep into the mysterious realms of human existence, unraveling the secrets of what makes us truly thrive. This podcast isn't just about information. It's a catalyst for change. Join me in confidently exploring potent natural solutions, cutting-edge health strategies, and igniting courageous conversations that cultivate meaningful connections and foster empathy for humankind. I'm here to empower you to unleash your extraordinary potential and lead a life jam-packed with boundless health and happiness. So get ready. Your extraordinary journey to boundless health and happiness starts now. Hello, listeners, and welcome to the Regaining Health and Humanity podcast. I'm your host, Dr. Scott Johnson, and it's always a pleasure to have you joining and listening. Today, we want to talk about essential oils, and I think that's a favorite topic among many people who follow me because I've written books on the topic and spoken about that many times. But I wanted to get the perspective of somebody else who's also well-versed in essential oils and especially in the research, because I think that is so important that we dive into the evidence and try and make evidence-based decisions whenever we're using our essential oils and uniting that evidence with the art of ancient healing. The popularity of essential oils and aromatherapy has exploded over the last decade. And fortunately, open-minded hospitals and healthcare professionals are beginning to incorporate them into their treatment plans. Today's episode is going to focus on 21st century medical aromatherapy from a physician who incorporates essential oils into his practice. But even better, he is also a trained aromatherapist. Dr. Geiger has been an anesthesiologist since 1986. He graduated from the University of San Francisco and worked in a San Francisco hospital doing cardiac anesthesia for his father, who is a retired cardiothoracic surgeon. Dr. Geiger has also been an aromatherapist since 2004, and it was in the hospital's recovery rooms where he first noticed nurses using essential oils and aromatherapy to prevent and treat postoperative nausea. He was intrigued by this and began studying the scientific literature on the subject. This research led him to recognize that sciences such as anatomy, physiology, and chemistry applications of aromatherapy were similar to anesthesia. He was determined to figure out how to integrate aromatherapy safely into his life and the lives of others, including his operating room patients. It's a treat to have him on the podcast to share his thoughts about medical aromatherapy. So welcome, Dr. Geiger. How is aromatherapy being used in modern medicine today, or what are you seeing as the most common ways healthcare practitioners or medical centers are using essential oils?
As I ask around the communities and run into friends who are going to the hospital and stuff, it's really interesting to note that the nurses are really, and mid-levels are the primary applicants of these techniques. And their barriers, physician barrier is a major one because they have no education in this area, which is unfortunate. Something that over the years I really worked very difficultly to gain acceptance and promote education, working on committees and all kinds of things to help bring it to pass, especially so that nurses could actually institute and implement aromatherapy treatments, aromatherapy management on their ward in pre-op is where I see it and knew it primarily the most. People, I mean, the nurses would search me out and say, Dr. Geiger's here. He's got ginger. And I would wear, I'd have ginger and lavender in my scrub pockets wherever I went, and people knew because the scent it carries, and that's part of the downfall, part of the rub about why people don't want it there. But on the other hand, it's also part of the benefit because it changes a very bad smell in an operating room to a very more tolerable smell. And the idea of peri-op use is really important because as I've gone through the literature and seen all the different perioperative studies that have been done, they've been primarily done by nurses in places not just in the United States, but throughout the world. And they do peri-op. They also do ICU studies for sleep, coronary artery patients, post-bypass patients, for helping them sleep, because the ICU is not a nice place to catch a good REM sleep. I put oils on my dad when he was in ICU, and they loved me for doing it because he needed it, and I had his permission to do that and share, and they just let me go to town on him. And when he finally got discharged, I did it at home for him, gave him massages from the kneecaps down to his toes often, and it was very much a rewarding experience for me because human touch is where it's at. And this idea of him absorbing it and having the benefits of all these different oils as ingredients of food, because the FDA says these are food supplements, generally regarded as safe. And we want ones that are pure and of maximum quality to be used in hospitals, to be used in surgery centers. But unfortunately, lowest bidder comes into play here. So that's a hang up. And that was part of the problem I saw in formulary and P&T committee, pharmacy and therapeutics, where they would get just any old mass spec or GC, and that fulfilled their checkbox that they had to have. It wasn't the batch that's on the ward that they were getting the mass spec on or GC on. And so that becomes an issue about this idea of adulteration and contamination of oils. You don't want the lowest bidder. So these nurses, though, when they would get the oils, they could get them in pre-diluted forms, and they always stayed they were trained in this low concentration mode, this 1-3% grapeseed oil. And I warned them, I said, don't use grapeseed oil, it'll get rancid quick, especially if you have a gallon jug. And so that didn't work very well. But then I would come around with just the bottle, tap it in people's hands and tell them to puff it, rub it on their ears and their forearms, keep it away from the tape for the IV site and the glue, because it kind of dissolves glue pretty nicely. But it also passes across, as you were saying, in the sinus to the brain, and through the skin to the bloodstream, to everywhere. And these nurses were aware of that. And they realized that if they could just get a couple of minutes and have an epic online computerized way to keep track of, we put 3% ginger on so-and-so at such a time, and this was the result, no complications, perfect, and move on. A lot got done that way, and in pre-op, in post-op care, in the ICU, and you name all the different settings of peds, tonsil surgery, ear tubes, GYN surgeries. Anxiety is major. In the peds setting, for all the different things in peds, the mom would be there. So mom got lavender, kid got ginger. It's just a couple of drops. Everybody's happy. It changes this atmosphere of you're signing consent that you may die. I'm going to take care of this. We'll figure it out. To, hey, what's he doing? He's using essential oils. He's into aromatherapy. Everybody's happy again. And then then we move to the operating room. It's the next level. But you change the level of anxiety with using essential oils. And there's so many articles about mood management in the literature, in the human literature. It's just phenomenal. I've gotten so inspired because of dementia patients. I talk about peds and newborns, but they can absorb and use oils just as well as dementia patients. But they need to be customized, tailored to the need. And here's the article that I was inspired to write. My mom had pretty severe Alzheimer's. She was in a memory care facility because she was a danger to herself and others. And she was great. Houdini, disappearing act, had to be locked up.
Mm-hmm.
But when I was anesthetizing dementia patients, I realized that many of them had behavioral issues, and they were on multiple medications, and some of them were provoking their dementia problems. So I was trying to figure out all the different things about oils in the brain, and it's such an important field that I think that in the future, that's the way to look for prevention: oils in the brain.
Well, you've kind of mentioned some of the pathways or the ways or the mechanism by which essential oils get into the body and some of the organs or the tissues that they interact with. I'm wondering if you can speak a little bit more on how essential oils work on a physiological level to produce therapeutic effects, and maybe any other particular pathways or mechanisms that have been identified through research by which some of the essential oils work.
Physiology. Wow. When you think about, as an anesthesiologist, about medications, so I'm giving an inhaled gas, I'm giving an intravenous whatever, and the body does things to those, and the chemicals that are in those do things to the body. Pharmacokinetics, pharmacodynamics. Oils have the very same applications. And the kinetics of oils is really, really crucial. We know from studies that lavender has a half-life, just like any anesthetic medication, intravenously or inhaled, has a half-life. And that half-life is defined by, number one, protein binding in the blood of medications. You know, how they bind to albumin or don't bind, or they're filtered by kidney or liver, or detoxified, excreted. You know, there's so many things about the chemistry of medications, oils, that are similar in terms of this idea. And it's very important to realize that if you really want a long-lasting effect of essential oils, you need to use it over and over and over again. There is no sustained release. You know, every 24 hours you take an antihistamine or you take a beta blocker, or, you know, that's all fancy pharmaceutical technology. But oils are simple. Oils like lavender have this really remarkable ability to work quickly and peak and then fade. And when my mother was severely demented and acting out and having behavioral problems, I could do a lavender hand massage on her. And for about an hour and a half, we were on the same page. She was calm. She was remembering. We were communicating. And that was my first experience with lavender. Jane Buckle, very famous British RN, PhD, who's written clinical aromatherapy books. So Jane Buckle gave me this hand massage, and I took my pulse beforehand, and I was, I guess, a little elevated, maybe 90 or so. But after she gave me this, her M technique of hand massage, which is very specialized in her name, my heart rate dropped by like 20%. And because it's the oil of communication, I was willing to listen to her and hear her describe to me what this meant and why I should look into it and become an advocate for essential oils from plants. And she was very convincing, so much so that I took her course, clinically certified in 2004. It was a major commitment. I mean, it was like every fifth weekend, 6 oils, 36 total, $200. I mean, we went at it with the massage course on the side. And it really meant a lot to me over the years to be able to say that I'm clinically certified. This idea of medical aromatherapy, it's not used much in terminology, but I like it as a title for this because I'm a physician. I believe in essential oils. I believe in the medical management of care for people with significant problems who need to integrate oils, and the physiology of the oils, the chemistry of the oils can be chosen by people who are schooled in it so that you can pick what kind of plant and which kind of oils from that plant, you know, where they came from, where they're sourced from, and put together a program for someone who has really maybe very significant problems, but still make it safe and effective in the management of integrative therapy, essential oils with medical care. medical health care.
Yeah, I like that you're saying these oils should be integrated more frequently, because I've said that essential oils really are in some ways one of the few natural solutions that can rival drugs in their activity, because they are so potent. They are fast acting in many ways. We have all of these great plant-based solutions available to us if people will just look more into the evidence behind them, the chemistry, and how they work within the body. One of the things that I see frequently in the literature is using essential oils as part of a pain management protocol. How have you seen aromatherapy being utilized for pain management in medical contexts?
Well, it's very interesting you should mention medical context for oils. Most people think of oils as being excellent in their redox potential, that they scavenge free radicals and they are aware of how they work on COX-2, COX-1,
Mm-hmm.
this inflammatory pathways blocking arachidonic acid synthesis and prostaglandins. Some may even be aware of that there's a difference in monoterpenes as far as cyclic and non-cyclic, and that some of them are more prone to binding in pain receptor pathways. They're not actually like mu receptors like narcotics, but there are other
Mm-hmm.
pathways that pain is mediated. And there are many different kinds of pain. You know, my father had allodynia, the kind where you can't touch his hand. And that's a really wicked kind of pain, hard to work with.
Yeah.
And so you need to experiment. I use the word experiment in quotes because technically anytime you get a prescription from a physician, you're like experimenting. Is this going to work for me? So I mean, you
Yeah.
need to look at different oils from different plants and see what's going to work for you. Is frankincense really, do you feel relief? Does lavender's a pain reliever. Linalool is very powerful.
Mm-hmm.
So you check out the different oils and see which works for you. Ever since I came across this oil called copaiba, whichever you want to pronounce it as,
Mm-hmm.
it has a definite article saying it's fast acting. I like that idea, and it's CBD2. When you're talking about CBD2 oils and what they touch,
Right.
that's a whole different category throughout the whole body. CBD2, so you can inhale, you can topicalize, you can even, ingest the oils. I'm not afraid to put oils on my tongue, the right ones, the right
Mm-hmm.
kinds. If you can stand the taste of some of them, they're special, aren't they? So
Yeah,
this
you mentioned
idea
one of
of,
my favorite oils with copaiba.
oh, I like that pronunciation. Yeah, copaiba is a very special oil. There's no doubt about it because of its selectivity, not
Mm-hmm.
psychoactive. So figure out what works for you. And like I said, frequent application, because it's not an extended duration management. It's how long you're going to be
Mm-hmm.
smelling this, how long you're going to be taking a bath in it, whatever. You got to be creative and look for different ways of delivery. And there are many, many ways that you can deliver things well and safe and effectively to people who are even in grave physical conditions, very frail. Frailty index in medicine is really an important index. And I looked at patients and I would go, I better be gentle with this one. She is very, very frail. And go about the care in the same way with the oils and only a little bit. Test dose, titrate, figure out. In anesthesia, you got a syringe full of something, you might give a small portion of it and see what effect you get. But watching the oscilloscope and the monitors and figuring out what's it doing to vital signs. And there's no reason
Mm-hmm.
why you can't actually monitor your own vital signs while you're using oils. I mean, get yourself a little pulse ox, a little BP cuff, and see how it agrees with you when you're testing it. I mean, if you're sick, you need to know what your vital signs are. Take care of yourself in that regard. It's something I've been a proponent of for the active personal management of your own self-care. That it's a really good idea to know what your vitals are, to know what your laboratory numbers are, what's your renal function, what's your chemistry of your liver. Do you have
Mm-hmm.
fatty liver? And you need to adjust and maybe even compromise on the dose or the sequencing of the dose, the timing of the dose, in order to make sure that you're doing good to yourself. as you administer these oils.
I think that's one of the keys to medical aromatherapy, since that's our topic, is we are relying upon labs, and we're relying upon biomarkers that will help us to guide the use of the essential oils, because there is so much research out there now on showing how essential oils affect these biomarkers. They affect liver enzymes, how they affect enzymatic activity in the body. And so if we can have those labs and those biomarkers, then we can use our essential oils more efficiently and gonna get better results because of it. What role does aromatherapy play in managing mental health conditions such as anxiety, depression, stress? And what do you find as the most evidence-based essential oils for these conditions?
Here's one. So this idea of psychiatric, I mean, we're talking about a psychiatrist. This is MD or DO level care, but mid-levels, especially in this idea of the fentanyl crisis and the sixth vital sign, where pain became basically a crutch for selling prescriptions of narcotics and hitting the mu receptor and making addicts. This idea of substance abuse disorder in DSM-5, changing it from addict in the old DSM criteria to saying it's a substance abuse disorder. You know, people who've been messed with psychologically in the system or of their own doing, oils can be really, really helpful and definitive in nature in terms of offering a therapeutic interchange to get away from the side effects of psychotropics, the antipsychotic meds that they put dementia patients on. Those are very deleterious to them. They make them more zombie-like, street people more zombie-like. So DSM-5 is groundbreaking in terms of helping people who need deliverance from substance abuse disorders. And that's a real psychological problem. And oils can be very instrumental in therapeutic interchange to help get people calm and peaceful and not drug-seeking. You know, the therapeutic interchange from street or prescription to essential oils and lavender, the citruses, the ones that are rich in terpenes, sesquiterpenes, the frankincense, the walking in the woods, forest bathing. The idea that you can do things for yourself, self-care with the oils as therapeutic interchange from abuse and the things that stresses of life that drive things forward and psychiatric diagnoses can be really problematic. And people have options if they find a caregiver, a mid-level, who can say, let's work on a program. I mean, that's what, when I'm doing my DEA relicensing, this program that I'm supposed to get a certain amount of units and education before I can get relicensed. It's very clear about how you have to work with people and get them to a point where they agree for care. And this agreement for care can start with lavender, the oil of communication, where you're working with someone to help them understand the depth of their problem, and that you can help them, that you can substitute, that you can provide other avenues of scent, other avenues of inhalation, other avenues of topical use of oils to benefit things and change the way that you feel. I think that's so remarkable in this day and time that there are things available, and we need to work on prevention of anxiety in its simple state and get people used to the idea that you can just use lavender any old time because you just feel like you'd like to use some lavender, rather than being at a point where, you've been committed somewhere and you're needing something serious.
Right. There is actually a lot of good research on helping people with those addictions that they can suffer with. And so black pepper is in the literature, clove is in the literature. It's we're finding more and more as we investigate more that essential oils have a place in so many different treatment protocols to help these individuals have better outcomes, which is what we want. Less invasive options with better outcomes.
Amen. Yeah, that's really important. I've even seen ginger to help people as a withdrawing substitute to help them get off of SSRIs, because you can have a kickback from withdrawing from medications, and even ones that are seemingly simple and were just prescribed for whatever, there can be a kickback. So ginger oil and the scent of ginger oil has been shown to be very effective with this idea of the chemistry involved in the pathways of reinstituting normal chemical pathways.
You've helped a lot of other healthcare professionals to integrate aromatherapy into their practice and help to educate people on how to use those properly. If a healthcare professional wants to, or a medical institution wants to start using aromatherapy and incorporating and integrating it into their conventional medicine treatments, what do you recommend to them?
Well, education is first and foremost, after a desire to want to check it out, important. There's so much literature out there, so much information that's available, and most of it's really good. I mean, you got to look at the downfalls of some of the medical research. I mean, not the least of which is many of the power studies that are out there are just so underpowered. They have a mishmash of could be good, not so important here, and they're underpowered. The idea of jumping right to a therapeutic level of care is really important, because otherwise you're kind of in the misty flats wondering, does this work for me or doesn't it work for me? How do I get it into my office? This idea of how do you get it into your office or your medical facility is really a challenging thing, because there are significant barriers, not the least of which is cost or the possibility of occupational allergies of employees. I've run across those in committees where we had to talk about so-and-so's reporting an asthma case, so-and-so's reporting this. The whole idea is preventative medicine. Take care of yourself before you have to get into these circumstances for personal use. And then find a caregiver who is actually amenable to the idea as you share with them. Since you should share with them what you're doing, you become an advocate for yourself and others by speaking up for the benefits that you've received from essential oils. I speak up all the time, so much so that I'm actually doing a course right now, and under natural solutions in this course, I'm educating men about essential oils, because the majority of them have never heard about it. And that's sad but true. So I'm showing them these articles and talking about the science. It's like mini med school for some of these guys, but that's okay. I don't mind. MedSpeak is a powerful thing, and that's why we're able to do it here on this talk. And I thank you for inviting me to share these things with you, because there's so much information that I have logged in my head that I really appreciate the opportunity to share what I think and what I know.
Yeah, I have a theory about why men have a harder time with essential oils, because women have more scent receptors or olfactory receptors in their body and a better sense of smell. But that may be why, but that's just a theory that I have. Can you share any case studies or patient outcomes that highlight the benefits of incorporating aromatherapy into medical treatments?
So glad you asked. Check out this one. So in Japan, this was 50 women who actually smelled rose. And they got increase in brain size when they did functional MRIs of their brain. Increase in brain size in age groups where you're starting to see dilapidation, shrinkage of the gyri and sulci of the cortex. That's a pretty phenomenal report. Japan has had some really, really interesting articles about care. And one of the ones that grabbed me in the past was when they were studying about pepper. You mentioned pepper, but did you know that pepper in the Japanese articles, they found people who, by diligent study and finding these very specific patients who had risk of aspiration pneumonia after having strokes, they couldn't swallow because of brain damage, couldn't swallow well. When they smelled pepper, their swallowing ability became more refined and more selective. But they'd studied little kids who had brain anomaly from birth, who didn't have that crossing over corpus callosum of the white matter, and they weren't able to get that benefit of better swallowing ability. So there's something about the way the two halves of the brain communicate for swallowing. Certainly there's all this, oropharynx and hypopharynx and all the cranial nerves that innervate that, you know, taste, swallowing, you know, all those cranial nerves, 5, 7, 9, 12, vagus, they all innervate through that. And when you're inhaling vapors, you're actually precipitating these chemicals onto the mucous membranes in the mouth and the oropharynx. That first article I showed about 1929, they identified the trigeminal nerve as being really, really important in that regard. So this whole thing about the idea of using oils to have this very selective effect in different groups and different studies, you know, underpowered is one thing, but if you can get it powered right, get the technique right, get the group right, you can get results with these oils. But you know what? There's so many studies. Why aren't we just out there using the oils? That's what I would say. You know, there's all these places around the United States and world where they want to do another study. They want to do another ginger study. They want to do an anti-nausea study, an anti-anxiety study. Why don't you just get out there and take the studies that are done as evidence-based clinical practice and get to work? Make a way that you can deliver these things to these people who have great need in these settings. If you do another study, it has to go through committee and IRB and slow. And it may be years before you get to any clinical practice. And it may be held up because of some little glitch in your underpowered, inadequately designed study. Just take what's there. There's so much evidence-based practice literature out there that is practical and is documenting the uses and applications.
Yeah, I don't think people really fully understand what goes into doing a clinical study on an essential oil, how much time and effort and money is involved, and the hoops that you have to jump through in order to do that. Because I often get asked by people, well, why don't we have more clinical studies on X? And I say, well, because who's going to fund it? Who's going to take the 1-2 years that it takes to run some of these clinical studies? What IRB are they going to get it through in order to get the study passed? And so it's really challenging often to even get a study published, to get the results, and then to publish it. And I think that what you said about using them is so important, because that experience really is going to validate the research that is out there already. If you actually use them, your experience will validate that research, but it's going to cement your belief and trust in these essential oils that can absolutely be used in medical settings and during treatments and as preventive molecules or preventive solutions that we need to put more emphasis on if we want to improve patient outcomes, if we want to improve health of humanity in general.
Absolutely.
Last question. What are the future directions you see for research in medical aromatherapy?
Wow. Well, first and foremost, personal prevention. That's your own medical health care. Because, this whole idea of aging. I mean, I'm 71 and I've been using oils for 20 years. And I think my epigenetic clock has been turned back to some degree in different categories of clocking. You know, there are all these different clocks in our bodies. Well, what age is your brain, your sight, your hearing, your immune system? We want to slow those down so that they're not aging so fast. Take your telomeres and keep them big and chunky rather than have them chopped off pieces every 10 years. Epigenetics is, I think, a major field to come to blows. I mean, first it was omics. I mean, when I talked at an aromatherapy convention in 2004, I talked about omic technology. In those days, they were using vats of bacteria to try and develop a terpene. You know, they were growing it in molecules and using it that way.
Yeah.
But now we know that there's genomics, proteinomics, immunogenetics. So many different fields are itemized in this omic technology. And this idea that you can take enzymes and block them with essential oils. Acetylcholinesterase, that's a key molecule for brain function, thoughts, and muscles. And in anesthesia, I mean, literally, we paralyze people. You paralyze skeletal muscles so that surgeons can open the chest, open the belly, get in there and do with things where all the muscles are totally relaxed. And then we reverse it with intravenous medications. But you can block acetylcholinesterase, the things that build up acetylcholine in your brain synapse by using essential oils. There are many, many articles about essential oils and brain chemistry. And that's a preventative healthcare to prevent aging of the brain so that you can maintain a healthy thought pattern as you age and not have to be put in a memory care facility because you're a danger to yourself and others. Prevention with essential oils, because dementia starts early, in life. You may start wondering why you're in the laundry room looking for something in your 40s. That's a tip-off. Get serious about prevention for your brain. Anti-cholinesterase essential oils and butyrylcholinesterase essential oils. So many wonderful studies about it. And it's really important to realize that eucalyptus is one of the major ones that they first looked at. But there's a crossover properties of essential oils. Some oils are better at things than others. I wouldn't want to use a citrus for one thing, but I would want to use it for something else. Like there's citrus in my drinking water often. But I wouldn't want to use it for pain relief necessarily because it's all D-limonene. It's just really interesting about how some oils are better at things than others. Frankincense is not so great when it comes to antifungal, but some oils are really powerful antivirals. I think all these different categories of function, when you think about the crossing of different specialties in medicine and in the future, infectious disease specialties, that's another major area. When we're talking about bird flu, there are essential oils which are very antiviral, extremely eucalyptus, again, one of those. But cinnamon for cognitive, when you're talking about the brain. There, you can itemize from the literature different oils which actually speak to very specific great properties that these oils are studied for around the world and promoted for what they find is really key in their ability going forward. This idea of pain management and substance use disorder, that's another key area for the future. But again, I'm still so much into prevention and integration on a personal healthcare level, and for advocates of things in medical care, as they listen to this and listen to your other podcasts and read your books, which are numerous and really powerful books that you've written. Man, you're a great author, Scott. And the stuff that you've put out there, I'm so grateful for. I've read many of them. And I think they are well done and very poignant, and they will live a lifetime going forward as being landmark articles. Just as some of these things that I've shown here, it's essential oils. Rose. I love the scent of rose, but rose, when I first came across it, was anti-conflict in rats. I'm thinking, how does that help a human being? I give roses to my wife when we've want to make up or whatever, that's okay. That's good too. But now we have an idea that it has a direct impact on brain growth. And many of the articles that are coming out that I've been reading lately have to do with neuroregeneration.
Right.
The oils can be used to regenerate brain cells and prevent the tangling of amyloid and tau and the hyperphosphorylation pathways. Bergamot. There's such great articles that talk about this list of oils which can work to improve brain power and neuroregeneration. Whereas before that was never available. So we're talking about the future now, where we're talking about neuroregeneration, where before I was taught brain cells don't regenerate. Well, that's not true anymore.
Yeah.
It's a myth.
Right.
It's gone the wayside of modern science. So I'm really curious to see what's going to show up in my searches when I start looking for articles, what's new in 2024 for this keyword or this long tail keyword, and getting the PDF from the librarian and being able to read it and itemize the details of it. Your work, I'm so proud of what you do and so thankful for your ability to run podcasts. This is my first podcast ever, but it's very important that we realize that oils have many great ways to impact your healthcare and the healthcare of the ones you love. So study them, learn how to use them, know how to use traditional therapies, and learn the new modern science and get enthused about it, and exercise. exercise in all age groups has been defined in different categories for different age groups. And you can use oils to help motivate you to get a better exercise regimen going. There's oils which are very stimulating and can be very thought-provoking in terms of getting you motivated to care in special ways for your special needs and the needs of others. I think the human condition and suffering needs to be alleviated, and you can do it in many different ways and many different avenues with essential oils.
Well, I'm so glad there's another person that's continually looking in the research. I appreciate that you're doing that, and I hope that you'll continue to send me articles that you find interesting if you have in the past. It's always good to have those because I may have not seen it. I really am an avid researcher, and I have hundreds of alerts set up in PubMed to send me research when they publish something new on specific essential oils. But I don't see all of them, and not all of them are indexed in PubMed. Sometimes you have to find them in other places. So keep sending me those. I appreciate the partnership and having you as a colleague to continue to explore aromatherapy and essential oils and the vast benefits that they can have to human health and the uniqueness in them. You talked about epigenetics. That's an emerging field in essential oils and how they're affecting that, but also some of the structures of the constituents or the compounds and chemicals that they contain and how they have high binding affinity to certain proteins and cell receptors. The more we can learn about how these essential oils work and what they're binding to, the better we're going to use them, the more effective we can be, the more we can really improve human health. So I really appreciate you taking time to be on. It's always great to talk to you and to learn from what you've experienced. And so thank you so much for being on.
You're welcome. This whole idea of affinity, I feel an affinity with you and the strength of binding with you as well. And that was when those articles came out, it went beyond biomarkers. It went beyond immune biomarkers and interleukins. We're just jumping in leaps and bounds into these fields. But still the basic thing is humanity and preventing human suffering. And the oils have compassion written all in them and through them. And the ability to be used really just needs somebody who is caring about giving the care and delving into this idea of oils from plants. Wow, that's a possible thing. I should look into that. I should use that. I could benefit from that. Just that one basic move can change your life. It certainly changed mine when I got a hand massage.
I think that's the final word for listeners today is experience these essential oils and see the life-changing effects they can have. I can't tell you how many people have sent me messages about how an essential oil has changed their life. And you can do it. You, with a little bit of guide and some basic understanding so that you have some guidelines and best practices in how to use essential oils, you can change your health trajectory. So go out and use them and experience them.
Well said, Scott. Thank you for directing these questions, which are very, very poignant, very poignant. Thank you.
Thank you for investing your precious time with us today. I trust you've uncovered valuable insights to elevate your health and enhance your quality of life. If you're hungry for more evidence-based wisdom to transform your well-being, I invite you to check out my 20-plus books, all waiting to be explored on my website, authorscott.com. Don't miss out on the chance to supercharge your knowledge. Please share, like, and subscribe to be part of the movement revolutionizing lives. In a world drowning in noise and endless information, your share can be the beacon that guides others to a better life. Together, let's make a difference by amplifying the life-changing knowledge you've gained today. Until next time, here's to your journey to boundless health and unbridled happiness.
Say